We were just listening to the CDC's Vaccine Advisory Committee. Today, they voted to change a decades-long vaccine recommendation for newborns. Fox News senior correspondent Rich Edson has more.
Eight votes yes and 3 votes no. The motion passes.
A federal vaccine advisory committee voted Friday to end the long-standing recommendation that all newborns in the United States receive the hepatitis B vaccine on the day they're born. Those in favor of the rollback argue there's been too little testing of the vaccine. They say babies should only be exposed to it at birth if their mother tests positive for hepatitis B.
If the mom is Hep B negative, which is the vast majority of women who deliver babies in the United States today, and they want to delay it until the kid is 8 or 10 or 12, let's be honest, hepatitis B is a sexually transmitted and bloodborne pathogen. So doctors have moved to a nuanced approach.
Meanwhile, vaccine proponents say routine shots help ensure all children born in the U.S. have lifelong protection.
We've heard do no harm is a moral imperative. We are doing harm by changing this wording, and I vote no.
Hepatitis B is a serious liver infection. It's spread through contact with bodily fluids, and mothers can pass it to their children. While some cases can resolve in just weeks, children are more prone to developing lifelong health issues, like liver failure, if they are infected.
I don't like the fact that 90% of newborns that get it have a problem because of it. I don't like this disease. It's preventable.
The committee now recommends the hepatitis B vaccine series only after a child is at least 2 months old. In Washington, Rich Edson, Fox News.
And since that vote came down, we did hear from President Trump on this. He posted on Truth Social just hours after that vote from the CDC Vaccine Advisory Committee. He says he's ordering a sweeping federal review of every childhood vaccine recommendation. Now, this is the full post from President Trump on Truth Social today. It says, today, the CDC Vaccine Committee made a very good decision to end their hepatitis B vaccine recommendation for babies, the vast majority of whom are at no risk of hepatitis B, a disease that is mostly transmitted sexually or through dirty needles. The American childhood vaccine schedule long required 72 jabs for perfectly healthy babies, far more than any other country in the world and far more than is necessary. In fact, it is ridiculous. Many parents and scientists have been questioning the efficacy of this schedule, as have I. That is why I have just signed a presidential memorandum directing the Department of Health and Human Services to fast-track a comprehensive evaluation of vaccine schedules from other countries around the world and better align the U.S. vaccine schedule so it is finally rooted in the gold standard of science and common sense. I'm fully confident that Secretary Robert F. Kennedy Jr. and the CDC will get this done quickly and correctly for our nation's children. Thank you for your attention to this matter. Make America healthy again. And before President Trump made that post, I did speak to an infectious disease specialist about this CDC ruling today, again, deciding to end the recommendation for newborns to receive the hepatitis B vaccine. Let's listen now to that interview. Thanks for watching Live Now from Fox. I'm Shauna Kalafi. Today, a CDC Vaccine Advisory Committee voted to end the recommendation that all babies in the U.S. should receive the hepatitis B vaccine on the day that they're born. So with more on this, we're joined now by infectious disease specialist, Dr. Peter Chin Hong. Thank you so much for being here with us.
Thanks for having me on, Shauna.
So this is a major move in newborn health care. What was your reaction to this news today?
It was one of sadness. Sadness not just for the babies of mothers who will be born with hepatitis B that will have a high chance of becoming chronic and leading to disease, but also a sad time for the nation and the world who sometimes look to the U.S. As beacons of what should be done in terms of improving the health of the population. So that's the feeling that I'm left with.
So this vaccine recommendation has been around for decades. Why do you think they're choosing to change this now?
Well, it's part of the dismantling of vaccines in general as a strategy. It's become very politicized. And although this is the most impactful decision that has been made so far, I'm worried that it is leading to a series of other changes that may come in the future around particularly childhood immunizations. It is mystifying that there is no new information either about safety and no new information about efficacy or safety risk. So I think that all of those make me wonder why it is happening at this period, except for the reasons that we had mentioned earlier.
And some of the people who are against this recommendation, they say that babies should only be exposed to the vaccine at birth if their mother tests positive for Hep B. So can you tell us more about how this disease is transferred from the mother to the newborn, and what would the risks be for a newborn with hepatitis B?
So this is a very transmissible and very infectious agent. It's 100 times more infectious than HIV. So even though they can both be spread by blood, and that's in fact how it can spread from a mother to a newborn through sharing that blood supply, it can also reside on surfaces for as long as a week. So it could be flecks of blood on a toothbrush, on a razor, on a surface that can lead to infants after they're born already being exposed. The other piece of information that's really relevant here is that in the perfect world, of course, we would test moms for hepatitis, and those who didn't have it didn't need to have their infants protected immediately. But in the real world, in the United States with our healthcare system, only about 1 in 5 pregnant women get tested for hepatitis, even with the best intentions. And about 70% of Americans don't know they have hepatitis. It's a very silent disease until it's too late.
And at the same time, people who are in favor of having this vaccine recommendation that has been in place for so long now, they say it helps ensure that all children who are born here in the U.S. have lifelong protection from this dangerous disease, like you said. So how could this all play out long term for healthcare? And could this maybe lead to other, long-term, long-standing vaccine recommendations maybe being pushed to the side as well?
Definitely. So, we think about infectious diseases as you catch an infection or you don't catch it, but it's much more, it goes much deeper with hepatitis B, because infection is one thing, but if you get it early, like infants in this situation, you have a higher chance of getting chronic disease. And those are the people who go on to have liver scarring or cirrhosis, liver cancer, and need for transplantation and ultimately death. In fact, in the early 90s, before this was implemented, universal vaccination at birth, we had about 20,000 cases a year. After it was implemented, we have about 20 cases a year. That is really powerful. More than 100 countries do this routinely. The WHO recommends it for people who have the resources. We do have the resources. And down the line, to your point, Shauna, it's not just only about infection and disease, it's the cost of the healthcare system, which would run into the hundreds of millions per year from the available research that we have.
And is there anything else with this new news? Again, the CDC Vaccine Advisory Committee today voting to end the recommendation for all babies in the U.S. to get the hepatitis B vaccine on the day that they're born. So for parents or people expecting, what advice do you have? What should they know in light of this recommendation ending now?
Well, I think that we will get back to that point of being a hodgepodge society of some states doing things a little bit differently from other states. But in the big picture, the 3 things that I'm really worried about is, number 1, loss of the CDC as a credible source of science and information. That's already been happening. Also evidence from, other surveys that have been done around the United States. I think it leads to more confusion not only in the population, but amongst clinicians, and that would lead to more variation in practice. And ultimately, number three, it would lead to more suffering and disease in Americans, because of, having to navigate the system, to have conversations, to not be beneficiaries of an intervention that's really, really safe and has been so effective to date.
All right, thank you so much for that insight. Again, Dr. Peter Chin Hong, infectious disease specialist. We appreciate your input here.